Hi everyone, welcome back to Pharmacology classes by MSR. In this video, I am going to explain about vaccine safety surveillance. So let's know what is vaccine first. So vaccine is a biological preparation. Why we are calling it as biological preparation means we are taking from the live microorganisms or live virus or live animals. So we term it as biological live. So, vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. And the process of administering this vaccine is nothing but vaccination, so that our immunity will be improvised and we will be protected from various diseases. Let's now focus on vaccine pharmacovigilance or vaccine surveillance. So, we have seen what is a vaccine, right? So, pharmacovigilance already we know to keep an eye on something, to detect the adverse reactions, to analyze them, and to minimize the adverse reactions. That is a major role of pharmacovigilance. Here, vaccine pharmacovigilance is the science and activities which are relating to the detection, assessment, understanding, prevention, and communication of those adverse effects which are followed by the process of immunization. So, what is the purpose of this vaccine pharmacovigilance is nothing but if we are keeping an eye on these vaccines, we can detect the adverse effects and we can try to minimize them so that we can give the best treatment or best benefit of this particular vaccine to the human population. So, vaccine pharmacovigilance plays a major role for the safety of the human beings. So, AEFI is nothing but the adverse events which is followed by the immunization. It is nothing but any untoward medical occurrence which follows after the immunization. So after the immunization process, whatever the adverse event is developed, that is called as AEFI, and that is not mandatory that all the AEFI should have some relationship with our vaccine. Any adverse event which is occurring after the immunization is considered as AEFIs. So these AEFIs are categorized into 5 types. So the first one is vaccine product related reaction. So because of the properties of the vaccine, inherent properties of the vaccine, if a person develops any adverse reaction, then it is categorized as vaccine product related reaction. For example, after DTP vaccine, usually people develop the limb swelling. So, extensive limb swelling, which is followed by the DTP vaccination, is example for the vaccine product related reaction. And the second one is vaccine quality defect related reaction. As the name indicates, because of the improper quality of a vaccine, if the ADR is developed, then it is categorized as vaccine quality defect related reaction. Sometimes if the device through which your vaccine is administered, if that is also not properly working, it also considered as vaccine quality defect related reaction. Recently we can see that because of the improper inactivation of the polio vaccine, it has developed many reactions. So that is an example for the vaccine quality defect reaction. And the next one is immunization error related reaction. So the process of immunization is not proper. So maybe the handling error, prescribing error, or the administration error, all this which can be prevented, but it has been occurred. So they are called as immunization error related reactions. For example, usually vaccines they may be available as multi-dose vials. So same vial can be used for many individuals. So during this process, the infection may be spread from person to person as it is a multi-dose vial. So that is categorized as immunization error related reaction. Not only that, because of the handling, prescription or administration any error, they are considered as immunization errors. And the next one is immunization anxiety related reaction. So because of the excitement or the tension, fear of getting immunization process or the process of vaccination, if they are getting any ADR, that is considered as immunization anxiety related reaction. Sudden fall in BP after a vaccination, all these are anxiety related reactions. And the last one is coincidental event. So the adverse event is developed, but that is developed because of some other reason, but that reaction is developed after the process of immunization. So that is coincidental event. A person may have some malaria or typhoid, but that is coming into the light after the process of immunization. So we consider it as an AEFI, but it is a coincidental event. What are the points we need to be considered when we are doing vaccine pharmacovigilance? So, though the AEFIs for the vaccines are very less or very rare, they have to be monitored. Even though they are not serious AEFIs, all the ADFIs should be monitored, detected, and they should be prevented. And the benefits of the vaccination should be increased. So, the procedures or the methods to detect the ADRs after the immunization process should be used very appropriately to increase the benefit factors and to decrease the risk factors. Normally for the drugs we do the de-challenging and re-challenging. De-challenging is nothing but either we will stop the using of that particular drug or we will minimize the dose. Whereas re-challenging means again we use the same drug, same dose and check whether the ADR is developed or not. But when considered to the vaccines, here de-challenge cannot be done because we are giving a vaccine once in a lifetime which can give the immunity for our whole life. So de-challenging is not possible. Whereas re-challenging, vaccines are the one which are given very rarely or very once in a lifetime or in the intervals, long intervals. So re-challenging and de-challenging are not so applicable for the vaccine pharmacovigilance. Usually, vaccines are combined together. One or two vaccines are combined together and given a single shot of injection. So, sometimes it may be difficult to identify the ADR is developed with which vaccine. As we are combining the vaccines, we can't identify with which vaccine has developed so and so ADR. And the second thing is we are giving the attenuated vaccines. So, sometimes the attenuation process may not happen properly and it may develop the infections. And in the vaccines, nothing but they are the biological products. So we are having multiple antigens or the live organisms. So because of what the reaction is developed, sometimes it may be difficult to identify because of the manufacturing process or the quality defects. There may be certain live antigens or any other thing which may cause the infection. And if a new vaccines or the new production is increased for the new vaccines, the technology what we are using, what route of administration you are going to give that particular vaccine, everything should be monitored before it is released into the market. And so depending upon the usage of this particular vaccine, they may give the immunity to a large number of people, which is termed as herd immunity. Nothing but if the vaccination is providing immunity to a large group of population, which is called as herd immunity. So we have to consider the risk benefit ratio when we are giving the herd immunity, and proper communication should be done regarding the safety of the vaccines, because if we are claiming any vaccine to be harmful, then it may give a negative impact on the human population. They may be scared of using that particular vaccine. So we have to give proper information communication to the public about the safety of the vaccines. Moving on to the objectives of vaccine pharmacovigilance. So, why we are doing vaccine pharmacovigilance is to identify the problems which are related to the vaccines, their different brands, the inherited properties of the vaccines which are causing the ADRs, to detect, correct, and to prevent the immunization errors while handling, prescribing, storage, and the administration process, to prevent the false blaming which are because of the coincidental events as we have discussed, but they are blamed as AEFIs, to maintain the confidence by properly responding to the parents and the community concerns and developing the awareness about the vaccine risks and their safety, to generate the new hypotheses about the vaccine reactions that are specific to the population of our country and our region, and to compare the AEFIs with the local population with the international data which is available, especially with the new vaccines which are being introduced. Determining the causality. Causality relationship is nothing but whether the ADR developed is really related to the drug or not, or vaccine or not, is nothing but causality relationship. So, to determine the vaccine causality relationship is sometimes very difficult, because as we have discussed, the de-challenging and re-challenging information will be missing. Why? Because we can't stop the vaccination once it only we use only once in a while or once in a lifetime or after a long intervals. So the challenging and rechallenging information will be lacking. And most of the vaccines will be combined together and given in a single shot. Two or three vaccines will be combined and given in a single sort of injection at a single visit for the kids. And vaccines are given at the age where most diseases are likely to be developed. And the vaccine storage, handling, transportation, administration should be done according to the specific and special conditions mentioned. If any of these procedures is not done properly, they may result in the development of ADRs. So, the process of identifying the relationship with the vaccine and the ADR developed may be difficult for the vaccines. What is the role of NRAs in the regulation of the drug safety? NRA is nothing but National Regulatory Authorities. So, the NRAs are responsible for ensuring all the pharmaceutical products, including the vaccines, that are used in our country. They should ensure that the vaccines or the drugs should have good quality with known potency, and they should check for the safety of that particular drug, whether it is safe to use or not. So we can ensure the quality and potency of that particular drug or a vaccine before it is being marketed. But the safety or the ADRs can be identified only after the drug is released into the market or a vaccine is released into the market. So NRAs should ensure good quality and good potency and the safety of that particular drug or vaccine. Sometimes it is very rare to identify the ADR, so it can be evaluated. The safety of the vaccine is evaluated after the it is marketed or the drug or vaccine is being marketed. Post marketing surveillance can only identify certain rare ADRs. So the pharmacovigilance is usually conducted by the National Pharmacovigilance Centers on behalf or in collaboration with the NRA, National Regulatory Authorities. So this pharmacovigilance center will do the post-marketing surveillance. They may conduct this post-marketing surveillance to identify the ADRs, to collect the data of the AEFIs by using the standard methodologies. They do the data analysis and they communicate with the NRAs about the safety profiles of the vaccines. So the vaccine surveillance requires a modified surveillance system. So though the vaccines and drugs both are considered to have a same method for the surveillance system, the vaccines require a special modified system to identify the ADRs. So this surveillance system will ensure the quality of the vaccine, to identify the ADRs, about the storage and handling procedures of the vaccine, how the vaccine is administered, how the shots are disposed, and the management of the waste. All this should be surveillanced by this pharmacovigilance team to identify the ADRs. Storage of the vaccines. So we should carefully select what is the proper storage unit per particular vaccines. We should use a calibrated thermometer or a temperature recording device to ensure the temperature in each compartment where the vaccines are being stored. And we have to evaluate the cold chain procedure to ensure the vaccine storage, and we have to use proper guidelines whether they are handling or not for the storage of the vaccines. And we have to inspect the vaccines once we receive them, and we have to monitor the refrigerator and the freezer temperatures to maintain the proper temperature in the cold chains for the storage of the vaccines. And we have to rotate the vaccine stock so that the oldest vaccines are used first and the new vaccines can be stored for future use. And if any error occurs during the process of vaccine storage or the administration, we have to take the corrective action immediately to prevent the happenings, or we have to immediately notify whatever is happened to the public health authorities. To avoid the immunization errors, the administration process should be done very carefully. We have to never administer a vaccine if it is expired. Don't use an expired vaccine or expired drug. And always administer the vaccine within the prescribed time periods immediately after the reconstitution. We have to wait to withdraw the vaccine into the syringe so that immediately we can give that particular injection or administer that particular injection or the vaccine to the particular person. And until unless it is approved by the FDA, never ever mix two different vaccines in the same syringe. Yes, two or three vaccines are combined in a single shot, but it should be approved by the FDA. Only the FDA approved vaccine should be combined in a same syringe. Always record what vaccine you are used, where you have administered, including the lot numbers and injection sites. You have to mention it in the patient's record. Timing and spacing plays a major role in the process of the immunization. At what time you are giving the vaccine, what is the time spacing between the two different doses of a single vaccine, these two play a major role for the appropriate use of the vaccines. So to ensure the optimum result, to have a good result for each vaccine, we have to follow the recommended immunization schedules for the children's, adolescents and the adults. So we have a childhood immunization schedule which is being updated every year. According to the immunization schedule only, all the child should be immunized. Let's see what are the major differences between the vaccines and the other drugs. So vaccines are generally taken by the healthy population or the healthy people to prevent the diseases, whereas the drugs, they are taken by the sick people. Why we take them? To prevent the diseases, vaccines are taken. To treat the diseases, vaccines, drugs are being given. How do they get them? Usually the physician will be administering the drugs or prescribing the drugs, whereas the vaccines, they are administered by the public health programs or by the process of immunization. When do they get them? So whenever a person is sick or ill, they will take the drugs, whereas the vaccines are taken usually during the childhood or whenever the time is required for according to the schedule of the vaccination, they are being taken. What about the adverse events? So the adverse events with the drugs are acceptable depending upon the severity, whereas for the vaccines they are accepted at very low. Though the ADRs are minor, we have to monitor them so that the vaccines are delivered for their maximum potency and safety. How many vaccines are available? Maximum, the globally recommended vaccines are 8 to 15 for the childhood, whereas for the drugs there are thousands of drugs which are available in the market. Reporting the suspected side effects to the VAERS, nothing but the Vaccine Adverse Event Reporting System. So this is a reporting system which will ensure the safety of the vaccines. So it will collect the adverse events after the administration of the licensed vaccines. So here the National Childhood Vaccine Injury Act, it requires the healthcare providers to report any areas, whether it is serious or mild. It should be reported to this particular reporting system. So what happens because of this reporting system? It helps for the ongoing evaluation about this vaccine safety. The Centers for Disease Control and the FDA will use this particular information from the vaccine adverse event reporting system to ensure the safety about that particular vaccine and to avoid the risk associated with that particular vaccine. Detection and reporting of the AEFIs. So who can identify these AEFIs? The parents of the immunized child or the infant, or the healthcare workers who are working at these immunization facilities, or the hospital staff, they can recognize and detect the AEFIs, the adverse events following the immunization. So it's their responsibility to detect these AEFIs and report them appropriately and to provide the treatment to that particular AEFIs. So, to identify, to treat, and to detect these AEFIs, the staff or the healthcare workers should have proper training and education so that they can diagnose the AEFIs and they should give the appropriate treatment for that. So, there are national AEFI guidelines which can be followed for reporting and detection of the AEFIs. The AEFI's reporting system plays a major role to identify the AEFIs and to prevent them and to provide the safe vaccine for the individuals. So the healthcare workers should be trained properly to detect any cases which are corresponding to that particular vaccine, the AEFIs corresponding to that particular vaccine, and if there are two or more cases in that particular place which are related to that particular vaccine. For example, a vaccine is being administered for 10 or 15 individuals in one hospital, whether one or more individuals are being reporting the ADRs after administration of that particular vaccine, that should be detected. And all the events which are believed to be due to immunization, for after the immunization process, whatever the ADR is developed, they should be able to identify them, detect them, and they should report it. What type of AEFI should be reported? So, any AEFIs which are considered to be serious, which are developed after introducing a new vaccine, or which are developed because of the immunization error, or any AEFIs which are developed but the cause is unexplained after 30 days of the vaccine administration, or if any AEFI is causing the parental or community concern, or the minor AEFIs like swelling, redness, soreness at the site of injection, if they are persisting for more than 3 days, they should be immediately reported. Let's see some questions which are related to AEFIs. Who should make the AEFI report and to whom? So, all the healthcare workers have the responsibility to identify and report the AEFIs. How should the reporting occur? So, the reporting should be done in a standardized method which is possible. And what should the route of reporting be? So, according to the local context, you can follow the reporting form, but make sure that no double reporting is done. Inform everyone, who all the stakeholders of that particular vaccination program, about the reporting, so that double reporting or under reporting is not done. How to improve or encourage the reporting? So, many of the healthcare workers are scared to inform about this AEFIs because they think that we may be penalized because immunization error is developed. If we inform them, it will be blame for our clinic. So, they will not report that particular ADRs. But all the healthcare workers should be trained and they should think it as their responsibility to report the AEFIs which are related to the vaccine, including vaccine testing in an AEFI investigation. So, when we are investigating the adverse event following the immunization, we should also include the vaccine testing. We have to check the vaccine also. So, we have to first conclude whether the vaccine is the reason for developing this particular AEFIs. So, what we should do, whatever vaccine is suspected to cause that particular AEFIs, if possible, if any residual is there in that particular vaccine, we have to take the vial of that particular residual vaccine. If that is not available, the residue is not remained in that particular vial, then we should take the samples from the same site which are unopened, or if any diluent vials if the vaccine was reconstituted, and they should be stored under appropriate conditions so that we can test it. Then if more number of cases are being reported because of that particular vaccine, we should check for the potency of that particular vaccine. For that we have to do certain tests. The first one is visual test. So visual test means by seeing whether you can see any foreign substances in that, whether the turbulence is developed or the vaccine has changed its color, whether the discoloration is developed. This can be tested by visual test. And the next one is sterility testing. Any infectious cause is been suspected for this, for the injection equipment or for the vaccine, that should be checked by the sterility testing. And the next one is chemical composition analysis. What are the preservatives used? What are the adjuvant levels? What are the abnormal components that are present in that particular vaccine should be tested. And the next one is biological test for the foreign substances or the toxins if abnormal toxicity is suspected. And the last one, any additional field performance should be, if possible, we have to collect it from the manufacturer. So this is an AEFI investigating form which have a basic details, the relevant patient information and the details of the examiner about the serious AEFI. So the other sections in this AEFI reporting form are the details of the vaccine which is provided at the site linked to the AEFI on the corresponding day, the immunization practice at the site of where this AEFIs are developed, and what is the cold chain and transportation, how it is done, the community investigation, and if any other investigations or observations or comments on that particular AEFIs.